Uh, my name is Danish Bhatti. I am the co-chair for APPNA Merit. I'm a movement disorders neurologist at the University of Nebraska Medical Center. I'm the director for Parkinson's disease program here. I'm the associate program director for our fellowship and for our residency program. And I'm also the director of international neurology program. I welcome you all on behalf of APPNA Merit to this webinar, which I believe our 46th or 47th webinar on the series of COVID webinar, which will conclude with 50 webinars. And we're starting to really touch on some topics which have long-term implication. So this topic is really close to my heart today, talking about effect of COVID pandemic on medical students education. But I think there are many, probably as many positive things as there are negative things about the situation. And I would personally want to highlight all the positive ones and where the medical student education or medical school education might be heading with this transformation through the COVID pandemic. So before we begin, I would like to invite Professor Waqar Azeem on behalf of APPNA Merit, who is a co-chair for APPNA Merit and also the lead for the student section in APPNA Merit, if he's available, to kindly give a welcome note to everyone for this session and officially start it. Professor Waqar.
Uh, thank you, Dr. Danish, for starting this. First of all, I want to say I think medical students are very important for APPNA and the cause of APPNA, and you guys are tremendous. Remembering my times, I can't imagine the kind of things medical students in Pakistan are doing. So you are far, far ahead already than what we were years back. And we are looking at a lot of different initiatives. And one is, of course, from APNA Merit with the International Medical Student Association in Pakistan, with Aliezeh and all the executive committee, that how we can collaborate and improve the medical education in Pakistan, how we can support the medical students in education, training, and research. And there are a lot of other things which we can do together. And we had our first meeting in this regard. APNA and APNA president is very supportive of it. And this is the first, but not the last seminar in this regard. And I think very important seminar in the same series we are having next Sunday, I believe Pakistan time at 8 o'clock, in which we have brought the ECFMG and the residency training directors from different specialties to talk about residency process, especially this year with COVID. So I think for medical students and fresh graduates, next Sunday, 8 p.m. will be an important webinar. And again, I will welcome everybody, all the participants and panelists for joining in today. Thank you very much.
Thank you, Professor Waqar. So before we begin, I want to remind everyone of house rules. The process will be very similar. We'll have the first 20 to 30 minutes for the speaker to make her presentation, and then we'll have the panelists introduce with their comments, and we'll open up the floor for discussion afterwards. Please introduce yourself in the chat box on your name, your current status, your current practice or city, and anything else you want to say. If you have any questions, please put them in the Q&A section, Q&A area. In the chat box, they often try to get missed by us as we cannot really see or keep track. And then if you have or want to make a comment, you could use raise your hand function. And if I see your hand raised after the introductions and comments from the panelists, I will try to come to you if the time permits and allow you to have microphone and make your comment live. Otherwise, you can always send the information in the Q&A box and your question can be posted there. With that, let me welcome our speaker for today, Dr. Aliezeh Fatima Rai. Dr. Aliezeh is the current elected president of IFMSA-Pakistan, which is the International Federation of Medical Students Association. Dr. Aliezeh has a very impressive resume, and I would invite her to provide a brief introduction to her previous experiences, past work, before she take on this topic. Dr. Aliezeh, please go ahead.
Thank you so much, Dr. Danish, for the introduction. So my name is Aliezeh Fatima Rai. I'm a final year medical student from CMH Lahore, and currently I am the president for IFMSA-Pakistan. If I would want to describe myself in a few words, I would describe myself as a public health enthusiast who's working, planning, and looking forward to working for the community and for Pakistan. And I'm really glad that even after all these doctors are not in Pakistan, they're still bringing things back to the community. So I hope we can achieve this one day as well. Thank you so much.
Very good. Dr. Aliezeh, please go ahead with your summary on the current challenges and future directions of medical school education with the COVID pandemic.
Thank you so much. So today we will be talking about the impact of COVID-19 on the Pakistani medical education system. So before I dive into the challenges and the advantages of this pandemic, I would like to discuss this, that we can always count the advantages and disadvantages of this pandemic, but for those who have lost their lives to this disease will always have sorrow alone from remembering this time. There might be very lucky individuals in our audience who can consider this as a good time for them. But for most of us, we will realize that our lives were impacted negatively as well as positively, whether it was working from home or not being able to graduate, whether it was working tirelessly in your house job or getting tested regularly, whether it was staying without your parents or whether it was experiencing an online graduation. None of us are the same after the pandemic is coming to an end. We will have to take this entire situation into perspective, all these things, and we shall only be dealing with the medical education aspect of the Pakistani education system. So coming from a family of doctors myself, I have seen the fear in the eyes of my parents as well as my grandparents when we meet each other. These are several unignorable aspects of the pandemic. While it has brought us great harm and sorrow, it has also helped us all realize the strength and resilience within this human race and the youth. We have grown to realize we are all very adaptable as individuals. So in these days, I feel I have seen the quote by Charles Darwin come alive. I would like to quote him here. He said that it is not the most intellectual of the species that survives. It is not the strongest that survives, but the species that survives is the one that is best to adapt and to adjust to the changing environment in which it finds itself. So basically, I can say that this is exactly what our medical education system has experienced. So from learning to operate computers to tracking online assessments via the teachers, from realizing the value of hospital wards, which usually medical students don't initially realize, to watching YouTube videos to actually get the hang of examinations, and from underestimating the importance of people around us to yearning for the presence of class fellows. Can we have a 2-minute azan break? Thank you. Okay, so the azan is done. Can we start?
Please go ahead.
Sure. So basically, as I just quoted Charles Darwin right now, I would like to suggest and help us correlate that after realizing this theory by Darwin, we have seen that this is exactly what our medical education system has experienced. And we see that it has actually shown us a road of future and potential development. So from learning to operate computers to tracking these online assessments, from realizing the value of hospital wards, which I'm going to say that medical students don't actually realize their importance, to watching the YouTube videos to learn examinations, and from underestimating the importance of people around us to actually yearning for the presence of our class fellows, we have definitely been impacted. And we have undergone several changes which have made us stronger and helped us take a back seat in this entire scenario. we have zoomed out on our perspectives, and we have pondered over our education systems. So the COVID pandemic has brought us forcefully to a point where I feel the medical education system has been revolutionized for the future. And it shows us we have a chance to develop it more, to succeed at our vision and achieve the goals that we eventually want. So basically, there have been several challenges as well as several advantages. So considering that we will be brushing on the disadvantages and the challenges that we have faced, I would like to just briefly give an overview of how was this beneficial for the education system. So number one, I feel that no community medicine teacher would ever have to tell their students the definition of a pandemic. They will never get it wrong. So that's one of the most important things I feel. Apart from that, I feel medical students sitting back home have gotten that time to prepare for the international exams, which they never had. They always thought we never have the break. So they have gotten this dedicated study time to commit to their future, where they can build a road for themselves. Apart from that, I have seen medical students write very good research articles. So while some have wasted their time, others have used this time very fruitfully as well. There has been access to resources. I remember Dr. Danish also mentioned we never had good online resources, but now as a result of the pandemic, we have great online resources, and they're accessible to all and they're free. Apart from that, we have all become very technologically advanced. Again, we had to adapt to this situation. We had to come in united at a platform, and we used apps like the Zoom and Google Meet. So we have become really technologically advanced, and we have realized the importance of human touch in the process. We have realized the importance of palpation, percussion, auscultation, which we definitely did underestimate initially. All our litmans have been sitting in the cupboards. Dirt has been accumulating on them, and we haven't been able to use them. There's still, we still want to unbox them. We still want to wear that white coat and walk into the ward with pride and feel as doctors again. But this sadly hasn't happened, but alhamdulillah, it's coming close to it, considering the pandemic has, the lockdown has eased. Apart from that, we have realized the importance of everybody's time. We have realized how important it is for teachers to deliver their lectures, and we have to be there. We have realized the importance of everyone's time, considering the online lectures have to end on time. There's several aspects, innumerable aspects, and I feel it is going to be relative to every medical student how they have learned over this pandemic. And apart from that, we have realized how studies have revolutionized, and how we can use an online platform to make information very accessible. So there's several disadvantages, and I would like to brush on a few of them, and I would like to give the room to my panelists so that they can also elaborate on them. So considering among the few disadvantages that I would like to brush on is the timeline of the graduation of the medical students, as well as the timeline of the doctors and the medical students who wish to give international examination so that they could qualify to go into another country. So this has created a disparity, and we feel that there's going to be a huge number of medical students appearing in international examination once we are allowed to give them. Apart from that, there has been an inevitable delay for final year medical students in the transition from students to doctors. This has mostly been for final year medical students. So students have lost out on months of intensive preparation in transitioning from a student to a doctor. They have lost on months on hands-on clinical experience, which now as the curriculum is being designed, they will be squeezing several weeks over just a few months, just to squeeze them down to deliver as much information as possible, which I feel is going to be very difficult humanly to absorb all the knowledge. We can definitely refer for a theory to the books, but for the wards, hands-on clinical experience is the essence of learning a clinical examination. So I hope we are as good as our predecessors. We have good clinical skills, considering we won't have ample experience. Apart from that, there has been an indefinite gap between the lockdown and the start of studies, where lots of medical students, whether we believe it or not, have not studied. And they have actually enjoyed this vacation. So that is going to be a challenge for every medical student independently who is trying to cover the course now that the schedules for their annual examinations are out. Apart from that, we have seen this as a huge fact in curriculum disruption. Many medical schools had modular systems. I feel that those have been disrupted, while the others had their annual systems. Annual systems might not have been disrupted as much as the modular system has been, considering they had made an integrated system. So we might be facing this challenge of how we can actually help blend the words with the theoretical examinations, considering it won't be possible because the online classes have actually completed the course of most of the medical schools. Apart from that, we have realized that there is a need for a very strong public health wing in every country. So we have realized the importance of community medicine, which is definitely a subject which isn't given much importance. So most of these things have brought us to several realizations, and it has been easy for us to actually pinpoint the gaps and the holes in this entire system, as well as our mindset and our perspectives towards medical education and our education process. So I feel the greatest and the most positive impact of this is that we have actually realized now that we can see these problems in our system, we can actually identify and we can put our finger on them, and we can actually plan to move forward with it. So these are some of the disadvantages I wanted to brush on. Now I would like to give the floor to my panelists.
Thank you so much.
Thank you so much, Dr. Danish.
I think that was a very comprehensive summary of the whole situation and scenario. I am the glass half full kind of guy, so I'm always looking at the positive aspects of things. And I see some of the points you make. When I started my first year of neurology residency here in the United States, I asked my mentor, when he started rounding with us, he asked me, Danish, what do you want to learn this week? And I said, well, I want to learn ophthalmoscopic examination and I want to get better at it. I haven't learned that really well. And I was expecting he will start teaching me every day. He looked at me and said, okay, do 100 ophthalmoscopies and then we'll talk again about this question. And so I think the concept was the skill is by keep repeating and doing and fine tuning yourself. I say similar things to my trainees, my fellows, that if you want to be able to tell a mild rigidity from a completely normal limb, you have to examine 100 limbs before you start getting the hang of it. But at the same time, I think more recently, on the flip side, I have been introduced to the idea that it's not the number of repetition, it is the repetition with a clear targeted feedback of what you're doing right, what you're doing wrong is what's necessary. And you can actually achieve the same thing that you would do in 100 repetition in 5 or 10 repetition if you had that guided feedback and someone telling you exactly where you're going wrong and tuning you. And now they're saying in America, it doesn't even have to be a patient where you practice the ophthalmoscopy. Put a dummy with a specifically designed eye and practice on that eye for 10 times and you get your feedback and now you're it. And that can be done in an hour now that needed months to do before. So I think what I would encourage everyone today to think about how the education might be 20 years from now and not where we think we have been in the last 20 years. With that, let me go around with the panelists and have them introduce themselves one by one to the larger audience and make their comment to the speaker's presentation before we open for Q&A. Let me start here alphabetically as I have it listed. So I would invite Dr. Amir Burney to please introduce himself and make his comment. Dr. Amir.
Assalamu alaikum, Danish. Thank you very much again. My name is Amir Burney. I am based in the UK, United Kingdom. I work for a leading medical school in the United Kingdom as co-director of studies for the medical school and their academic lead in clinical skills and as a senior university teacher. From my background, I'm an orthopedic surgeon and sports and exercise medicine doctor, but I've now worked full-time in medical education. And I must first thank Ms. Rai here. I think she raised some really important points in her presentation about the impact of COVID-19 and the pandemic in general on education, and especially on medical education. And I think in the UK, we found similar issues as well. Some, if not exactly the same, some on those lines as well. And these last 6 months have obviously put a lot of pressure on medical education, as well as on many other professional educations. And how do we go forwards? I totally agree with Danish here that we need to look now forwards. We've had this experience, we must learn from this experience. You mentioned that in all calamities, there's always opportunities. And I do believe so that we must believe in the positive side of things. Before I go forwards, I must obviously say something about the friends and colleagues we've lost to this pandemic. So may Allah subhanahu wa ta'ala give them the highest abode in Jannah. And also sort of many of our friends and colleagues are still unwell, both here and abroad. And may Allah subhanahu wa ta'ala give them shifa kamil. Moving forwards, I think we should always stay positive. We should always find opportunities within calamities, as I said earlier. The impact on COVID-19, I think is going to be, if you start looking at how we're going to limit the damage or how we're going to move forward, is both short-term and in long-term. And you're talking about the impact on students. I'm also talking about impact on faculty and medical educators and clinicians who partake in education, because we have to learn new ways of delivering the education. You mentioned new ways of learning technology and considering our ages. I won't tell you my age, but technology is always a bane for many of our colleagues, and how to use platforms, and from Blackboard to Zoom to Google Hangouts to Microsoft Teams, you name it. There are all sorts of platforms out there. And credit to our generation of doctors and the young ones that we actually got together and we found suitable platforms to actually work through. I think I will stop here because I'm really interested in seeing what Professor Saab has to say about Azeem and Maha Rehman. But I think the conversation will generate more comments as you move forwards. So I would like to stop here and then see what other esteemed panelists have to say.
Thank you, Dr. Amir. So I think Dr. Maha, you're next because Dr. Aqsa dropped and might join us back. So Dr. Maha, please introduce yourself and make your comments. Dr. Maha, we are not able to get your audio. We have to select a different microphone from the menu.
Can you hear me now?
Yes.
Okay, awesome. So I was talking about, my name is Maha Rehman. I'm from Pakistan, born and bred here. I'm a medical student in final year. I've also been serving IFMSA-Pakistan as Vice President of External Affairs, and I've been affiliated with external organization, particularly working in the field of human rights and peace. As some of this, I don't know which speaker, but one of you has alluded before that we count on the positive aspects of the pandemic. Of course, it has bring a lot of disasters in the countries. There was a lot of irregularities in the medical system and everything. But there, I personally think that it also got a lot of positive aspects. I've been recently to a conference, and me as a medical student from a developing country haven't had heard about the developing countries doing so much researches, allowing their students to practice on robotics and having visual contents and a lot of things. It felt like a movie. It felt like I was in a different world. But I feel that because of this pandemic, our teachers or our universities had more avenues to approach and more avenues to look for. They introduced new things. And before, they were, I don't know, they might be scared of introducing new things, but this pandemic gave them confidence that they can bring the things here and they can actually introduce it. And it's not always like with the first step, we are going to be successful. It's like at least we were able to take the first step that was long due, that we weren't able to do for a very long time. So I was always talking about the positive aspects that this pandemic has brought. Of course, I agree with Dr. Amir that we have lost a lot of lives and everything, but it did give us edge. It did give us a knowledge that research is very important, and for the medical students too. It's not always that we are to be doctors and then going into the research. We can always start early. We can get ourselves prepared, because I think preparedness is one of the best things that we could do to prepare ourselves ourselves for the future disasters, because we are living in 2020 and we don't know what's coming next. So this is just my personal feeling, and rest I agree with all of the speakers that have talked before. Thank you.
Thank you so much, Dr. Maha Rehman. Let me go to our next panelist, Dr. Aqsa Shafique. Dr. Aqsa, please introduce yourself and make your comments.
Assalamu alaikum, everyone. I hope you can hear me loud and clear. Okay.
Yes.
First of all, I would like to thank APPNA for extending a hand of collaboration with IFMSA-Pakistan. And I would like to appreciate the fact that many of the members who go out of Pakistan, we call it a brain drain, and who go out of Pakistan, it's a general misconception that they do not come back. And this should be a kind reminder to them that there are members who go out of Pakistan who are still thinking about Pakistan, who are still thinking about Pakistanis and trying to work for them. And we have to appreciate your efforts. Thank you all for all your efforts and all your success stories that will bring success to Pakistan as well. Coming on to my introduction, I'm Dr. Aqsa Shafique. I have recently completed my house job in May, and now I am preparing for my psychiatry IFCPS exam, which is due at the end of September. Going into some of the background to elaborate my introduction, I started my journey in IFMSA when I was in second year, and I started it with medical education itself. I was the local officer of medical education who became the national team member and then the national officer. And I pursued capacity building and furthermore became triple or quadruple trainers in IFMSA. And currently I am the supervising council, and last term was my presidency in IFMSA-Pakistan. I am an extensive medical education enthusiast, but I would not refrain to say that my journey in medical education began by looking at the flaws in the medical education system of my country. And many of you might have started your journeys from the same aspect. And coming from that perspective, I would like to say students don't even know about medical education in Pakistan. Students, I'm saying. Why I'm saying this is because until unless you go out of your house job and you start looking for jobs, you start looking for avenues you want to pursue in future, you are thinking you are a clinician, you are a future clinician, you want to pursue psychiatry, cardiology, neurology, you want to become endocrinologist, but you are not thinking about medical education as a career. So I would like to clarify this point here, that Pakistan is suffering from a clear career bias in medical education. And I would give it a touch of public health as well here, which is a bit ahead of medical education in Pakistan. With regard to COVID, I would like to say there have been webinars, there have been training platforms, there have been activism and medical educationists in Pakistan as well as across the world, I would say, who have been working on medical education through online platforms, which has been the first ever time I have seen this being done in Pakistan. And I would say even across the globe, because this is something that we wouldn't have realized if COVID wouldn't have come. So we should thank COVID as well. No matter how many lives we have lost, we did gain some positive perspective, as all the speakers have mentioned. And before I close my statement, I would like to say one thing. Back in first year or second year, when I used to talk to my brother who's elder than me, he used to tell me that, oh, I've got my lectures from my teachers, and I've got this from my teachers, and I'm gonna go through them, and I'm gonna check them out. And I used to be like this, that our teachers don't give us their lectures. Our teachers keep their lectures to them, and we are not shared with online facilities that they're using. We have to search on YouTube, we go to Dr. Najib, we go to Dr. Bean Corp, and we find out other resources that are out there. One aspect that has affected me and many medical education teachers, faculty, students, and researchers of Pakistan is the fact that there has been an open access to resources, and that has been highlighted before as well. And it has amplified the efforts of those people who have been working on open access in past. There have been consultations and stuff like that. But yes, COVID has not just affected us in this regard, but has helped us open avenues towards not just open access, not just medical education itself, not just education itself, of students and faculty, but also to the avenues that we have not been pursuing or have not been open to, and we're actually stigmatizing, just like sharing our resources. So that is something I would like to share. And thank you for having us here.
Thank you so much, Dr. Aqsa. And then lastly, I would invite Professor Waqar to make his comments about the presentation.
Okay. Thank you, Danish. First of all, I would say that I'm extremely impressed by the caliber of our speakers and panelists. Dr. Aqsa talking about the importance of medical education. Of course, it's a neglected field, not just in Pakistan, but I think all over the world. And now a lot of innovative things are coming up, which all of you mentioned. Dr. Amir, Burney, thank you for sharing your thoughts and kind of innovative things you're doing in UK. Mashallah, I see all the webinars you and your colleagues are doing and contributing to it. It's great to hear Maha's perspective on all the positives you folks are doing, and especially impressive at a medical student level, you're talking about public health. That's unbelievable. Like, we learn about public health farther in our career. And I think it's extremely important area if you want to tackle anything. Regarding public health, and I was looking at some of the literature regarding the medical education impact and what are different models used to help the medical education and medical students in this pandemic. And one which I thought was really creative and makes sense is public health model is like, for example, if you know about disaster management, and there is very nice papers written about it, that how we took medical education in this pandemic as how we manage disasters. So if you think about, for example, the first is usually early and coordinated response, which, so some things which you might already did, but some things we might need to do it in the future too, that we need to have an early response and coordinated response between the medical schools, all the agencies who oversees the education, and all the hospitals. Then how you do the impact analysis, that what is the impact, not just on medical students, but on the health as a health system as a whole in the country, and what kind of funding needs are to manage this. So that is extremely important, the first stage. Second is, then you look at what are the alternatives, and you already talk about some of the alternatives like online classes and online lectures and those kind of things. One thing we did creatively with Weill Cornell Medical College in Qatar, that we did virtual appointments with patients, and we have a three-way dialing. So we have medical students actually participated in our consultations with the patients. So I think it was not easy, but with patients' consent, we were able to pull off. And as Aliezeh was saying, and Maha was saying, that we able to do a lot of research projects with our medical students. And also what we did is, other than patient care, one part of medical education and medical studentship is how we mentor them to be not just better physicians, but as better human beings, better leaders. So there are a lot of other things which we try to do to mentor them. Other thing is the last part of usually disaster plan is what you do in the future, that what you did now, how it will change the future, that how we offer the medical education, because some things are here to stay, whether it's COVID, whether it's online, whether it's Zoom, they are here to stay. So I think we need to plan all those things. I think that's a good framework to do that. Actually, one question Aliezeh put was, I hope it's okay. I'm not saying you doctor, you still have one more year to go. I know
That's correct.
Daniel is calling you doctor. I was thinking, what should I say? I said, might be in a year,
That's
but you're our
correct.
colleague, all of the medical students. some people were very actually radical. Actually, some were proposing the main goal of medical student is education, not anything else. And some people even propose the way we are bringing first years, should we even bring first years this year and have final year do 6 more months or 1 more year? I know for some people financially it can be a huge issue, but at least in my experience, 6 months, 1 year on the long run, it doesn't matter much. When you go into your trainings, whether it's abroad or Pakistan, financial reasons I can understand. Other than that, it doesn't matter much. Whether you spend 1 year or 2 more years to achieve your goals, I think it's worth it that you do the things the right way. So those are some of my ideas and comments. Thank you.
Thank you so much. So I appreciate all the comments from all the panelists. We'll start some discussion. As I said, that please feel free to raise your hand if you would like to have microphone to make your comment. Just press raise your hand button and we will try to get to you. You can also post your questions in the Q&A box, and you can keep making comments in the chat box, but questions in the Q&A box will be preferable. So let me start with a question that I have been thinking about. A professor of neurology in Pakistan, a head of department, reached out to me when this pandemic started out, maybe 2 months ago. And so her question was to me that, Danish, we've been asked to make all these online modules for our students who will be doing rotations with us, who are not allowed to come in person. And I'm trying to put this together, but I'm confused about various things. So I'll take one example she discussed. And that was that we teach medical students a neurological examination, a clinical examination. And how can I do that on an online module? And how can I test? How can I teach? And how can I figure out? And that actually was very relevant to me because in our medical school, University of Nebraska Medical School, I am the person in charge of teaching the neurological examination in the neurology rotation. So that's my only piece. I do mostly continuing medical education and residence and fellows education. But in medical school, the only role they gave me, fortunately, was teaching that one component. But then they asked me to completely flip it to online. And we did not change any of our medical school's rotation schedule. Everything continued the same, and we were given a 2-week notice to start putting our stuff online and to flip it and start teaching online through Zoom sessions or something like that. And so I had gone through my own thinking of brainstorming of how can I teach medical students on neurological examination and how can I assess they learned it, because that's part of it. Instead of doing a face-to-face either on Zoom or self-paced or things like that. So I kind of discussed with her some ideas I had. But before I share my version of things, how I did, and it was very early on, I made many mistakes. I would love to think about this question is that the challenges that it brings us gives us opportunity to innovate to do things differently. And we should ask question why it has to be that way. And we have stopped asking that question. We just presume, oh, it has always been done that way. But that is not a good enough reason to say that we should just keep doing it that way. So that would be my one question to you. How do you see, beyond just watching a video lecture, what other things you see in terms of engaging the medical students and assessing their learning, assessing their engagement, and maybe even to a point of imparting some clinical skills to them? So I can start with the speaker and then we can go around the panel and see if other people want to contribute.
Thank you for the question, Dr. Danish. So basically, if I got it right, so we want to elaborate on the ways that we have to deliver education right now and how can we refine them, right?
Yeah, or let me pose this challenge to you. If you were designing an online way of teaching neurological examination, what would you do?
Okay, so thank you so much. So I feel, as Dr. Danish just said, we have a very important concept in IFMSA-Pakistan trainings, which are simulations. So basically, we mimic a certain scenario, and we provide it to them so that they can feel as if they were in that situation, whether it is to teach them empathy or whether it is to teach them a certain concept or anything of that sort. So I feel a simulation will be a very strong thing in this regard. So we're usually living in families and in houses where we have people around us. So going through a video of a neurological examination online and actually mimicking it in front of your teacher on a Zoom call might actually be helpful, considering it's going to be through them and you can correct them, and it's going to mimic the word round. So I feel that is one of the things. And apart from that, I feel we have very good online videos as well. And some are paid, some are unpaid, and the unpaid content is also up to the mark. And if we have our books right next to us and we can do a simulation for our teachers, I feel that we should master most of the concepts of a physical examination. So would the panelists like to add anything? You guys can go ahead.
Yeah, anyone wants to add anything? Please go ahead.
If I may go first. Yeah, it's interesting what you raise about how to generate interest, because like anybody, students can get distracted, the interactivity can drop, the interest in asking questions might also drop, and we've experienced it online when you deliver online sessions. So the range is enormous, because you can go from delivering online lectures to breakout rooms and small group sessions as well online. So I'm just talking and focusing on online, and just give you a few examples of how we thought of generating interest by giving a flavor of different types of online learning sessions. So when you break it down, it's really about, when you talk about medical students, it's about history taking, communications, and the clinical skills, either procedural clinical skills or physical examinations of. So those are the 4 areas we sort of broke them down into very quickly when you started looking at how do we deliver medical education in over the last 6 months from March onwards. But suddenly we had some innovative ideas. History taking, I'm sure Danish and Professor Saab will also agree that a lot of these conversations are now beginning to happen through telephone. So in primary care and family medicine in the UK and in consultations, quite a few times the doctor's actually talking to the patient over the phone. So that's a new skill for our new generation of doctors to learn as to how to take a history or how to listen or communicate with the patient over the telephone and then make an informed decision about what's the next step. So that is something we incorporated very quickly for our third-year medical students here in the school I work in, where they were assigned a patient to talk to in a week and then write a reflective report or upload a case summary of the conversation with that patient to a portfolio. So they worked with a few patients over the past few weeks, and now they have a portfolio of patients. So when they go to clinics, they have this background knowledge of what the patient was all about. And then when they actually see a real patient with the clinician, then they are not coming from a blank slate, they're coming with quite a lot of information. The other thing which we did, in fact, I did, was also to deliver for, we had 272 people in the lecture online, and I involved a volunteer for my session talking about how to examine joints, for example. We kept it very interactive. So the chat box is open for all medical students to ask a question. So the moment you have interactivity, students will ask those questions. And I must thank my son, who is also a medical student, who became the volunteer for the session and took his kit off to show his shoulders or knee joints or hip joints. But the impact of having a volunteer in the room, from my home, actually, we made one of our rooms into a little clinical area, and being able to interact with the students, for the students to type in or even ask the question. I think the moment the students have this onus of or the responsibility of asking questions, it makes these sessions slightly better rather than just delivering a lecture, because you could listen to a lecture online at home, relaxing at 9 o'clock at the night. Why engage with the lecturer? I think by having different tools or new tools, it helps. So I think Q&A sessions right the way through or halfway through are very important. Having volunteers, absolutely fine. If you do not have a volunteer, I've known people who've used pillows to demonstrate the abdominal examination by just drawing lines on a pillow and showing where the rib cage is and where the pelvic lines are and how you examine. So very simple tools can be very effective learning tools or teaching tools. So we can diversify as educators. Finally, I would like to, when we talk about assessments, we can talk about assessments in more detail, but I am just focusing on how we try to engage our students by developing new tools within the online platforms. I hope that's useful.
Thank you. Anybody else wants to add any comment to it?
Say, Danish, I think what you must be thinking, nobody else can think, I'm pretty sure. You have the most innovative mind, I know that. But I was thinking exactly the same. For any kind of exam, you don't need a patient, you need a person. And person can be anybody. You don't need somebody who's suffering from something. And I'm, being a child psychiatrist, is more inclined towards the empathy and interpersonal interaction, which can't come with videos and dummies, which come with personal interactions. Actually, when I teach medical students and trainees, I don't even use the word patient. And how I view it is, when you say a word patient, it means there is something wrong with you. You have to fix it. And as physicians and clinicians, our job is to help people, and people is about lives. And how we look at person as a whole, including their social part, is extremely important. A little bit diverting from the topic, but I think those are some of the thoughts. But Danish, I think you must have something else also.
Dr. Maha, please, I think you had a comment. Dr. Maha, we're still not getting audio, maybe microphone.
Can you now?
Yes.
Okay, awesome. So I had a comment earlier, but now I have a direct on Professor Dr. Waqar's thing. He said something about the interaction with the patients directly. Well, I totally respect the opinion, but I believe that I was reading a research paper earlier, and I believe that world is heading to a technology timeline, like in an AI zone. And we're not pretty sure that in the near future, doctors would be required or not, or we would have a pretty much direct interaction with the patients or not, or something like that, because they say that there would be robotics doing the stuff, and there wouldn't be this interaction that we are having these days. So with that, I'm moving to the next thing. I was in a meeting earlier with a colleague from Ecuador, and she said that I have to leave the meeting in 2 minutes because my teacher said that your virtual patient would die if you don't come and attend the patient. So this is like some sort of trainings like this that, you know, it doesn't feel make you feel that you're at home. It makes you feel like you're in the emergency zone, and you should be ready anywhere, and you should be in your senses. You shouldn't be alarmed when the teacher calls you that you have a virtual patient to attend. Similarly, like Aliezeh said about the simulations, it's sort of a simulation. The patient, the teacher checks you, the teacher directs you, the teacher would tell you, of course, its breathing rate is like this, pulse rate is like this, and you have to check what is the conclusion you're going to make out of it. So like I can also relate with the training. I'm also a disaster management trainer from Crimidim. It's a Red Cross association in Italy. What we used to do while teaching our trainees over there is that we get to know that students, because I am coming from that background, we get to know that students tend to learn more from animations rather than the PDFs or the textbooks or something like that. So we created animated dummies, or what you say, patients that were affected by the disaster directly, and giving them options, and then the participants were very able to answer according to what we mentioned about what was happening with the patient. Coming to that, I think that this is some sort of technologies that, of course, Dr. Danish would have a very good idea, but this is some like a student point of view, like how we students want our teachers to deliver something to us that we would learn and interact more with. Coming to the assessment points, I think that when the student is learning from such a perspective, I think we gain so much good content and so much good grasp on the topic that we would do very good in the assessments. There are some countries, I have friends in some countries in which there are no assessments at all, because teachers are so confident in the students that if you have taught them the right way, they wouldn't have to know about the assessment, or they wouldn't have to check the level through the assessment. So I think that like since we're heading to such an era, technology is very important, and of course innovative technologies like this should be incorporated, and teachers of course should be given trainings, because they are not coming from the same background as us. They don't know about technology, they don't know much about it. They can be thinking critically about how to involve students in it, but they should know that like they should be treated, or they should be getting trained on how to how to relate technology with the studies these days. So that's my 2 cents on the topic.
Thank you, Dr. Maha. Dr. Aqsa, do you have anything to add on this?
Yes, I do. And I'm gonna talk with reference to both Professor Waqar and Ms. Maha's point of view. That is, I'm in the middle, I guess, since I was just a student recently and I'm just going to be a teacher soon, maybe. So I'll be talking from both perspectives. And yeah, it comes with a heartbreak, knowing that we will not be dealing with patients directly. We have not been dealing with patients directly. And we have sort of been sensitized by this COVID situation. With this fact that we can actually accept not being with the patient live to guide and teach our students. And this acceptance has brought us down to accepting AI as well. So Professor Waqar's empathy and Ms. Maha's concern regarding AI has come to at one place. But answering Dr. Danish's question, you have a neurology class. How will you make it innovative and interesting? To be honest, human mind is a gift. It is a great blessing of God. It is only a fact of using it, be it a teacher, be it a student. And once we start using it, there are certain things that we have to assess within our own selves. Are we actually giving the students our all? Are we actually concerned about the student? Are we actually putting ourselves in the shoes of the student once we have become a faculty member? Once we are there, are we trying to make it interesting, make it innovative? Are we trying to make the student want to learn it? To be honest, what I've seen is there has been a it's a phase of frustration, to be honest, because of the curricula that we are in, especially in Pakistan, and I would say the various countries in subcontinent. Just like I would like to state one fact: we don't have a gap year to go and have a master's in public health. We don't have a gap year or an option to drop out in third year and go do medical education. We don't have an option to drop out in third year and do anatomy MPhil instead, saving 2 years of our lives and become a teacher of anatomy or anatomist and save our future and save the future of other students at a younger age. We have limited our options. We have limited our innovation. We have limited our interests. Our interest is to go into the classroom, open our PDF or presentation, go through it, discuss, and out. Okay, we have moved one step forward. We have started talking about CBS, case-based learnings. We have started talking about small group learnings. Medical education has been advancing. We are doing small groups, large groups. We are talking about assessment, evaluation, feedback, social accountability. But the point I'm going to raise here for our virtual classroom is that, yes, there is AI. Yes, there are platforms, Slack, there's Discord, there's Miro, there's WhatsApp, there's Google Drive, there's Skype, you have Zoom, you have so many platforms to engage students. But everything that matters for a teacher or a student is engagement. It is the interest that you have to keep alive. And here I will end with the fact that once we are ignoring where we are ignoring our students' feelings, interest, or innovation, or trying not to engage them in here, or we're not trying to engage them here, we are actually doing the same with our patient as well when we are going into AI. We have to find out the reason for this gap that we're creating, and we have to cover this gap now when we are going into AI, so that the same gap we had with a live interaction does not exist in an AI interaction. Because unless until you have a bond with your student, you have a bond with your patient, just like Professor Waqar mentioned, you cannot empathize, you cannot keep their interest alive, you cannot make them want to come back and have more. So for that, yes, this is where the training comes in, this is where the session comes in, and it depends how into your students you are and how much you want them to become the leaders or the youth who would be teaching you more doctors in future. And like with AI, it's like people are becoming doctors even without an MBBS or an MD degree. They are becoming public health enthusiasts. They're becoming many more things. And doctors did not really have that worth before COVID. They were saluted after COVID came in. So we have to look at all these things that we might be facing just because we have not worked on meaningful student involvement recently. We have just started working on it. We haven't worked on social accountability. We have to look at all these factors and then work on any session, training, any lecture, classroom, or anything that we're going into, be as a student or as even a teacher.
Thank you, Dr. Aqsa. I'm going to make a quick comment, and then what I would like to do after that is to involve Professor Balkis Shabir, who is from King Edward Medical University, into the conversation as a local educationist and a leader in education in a local institution. And if you allow me, Professor Balkis, a quick comment before I invite you. I think, of course, I can share all the details of how I did it, but the one important point, I always think in first principles. I think an important point that is important to consider or remember is that we sometimes tend to split this idea of teaching and assessment as two separate things. And that stems from this idea that teaching is me saying things and you listening, and assessment and then, seeing if you got it and you pass or fail. But one of a big change that I have gone through in the education in 20 years I've gone through in US is that assessments are much more powerful way of teaching than lecturing. And we came up with this idea called formative assessment that form the idea in your mind. So in those assessments then are much broader term, and it's not just an MCQ anymore. An assessment is when I give a task of draw a basal ganglia to my fellow. And I say, okay, sit down and put down on paper what your understanding of the neuroanatomy of basal ganglia is, and you're being assessed that way. And it's an open book exam. You can open up whatever you want, but you have to draw your own concept, and it has to be innovative. It has to be something new that I've not seen before. You cannot copy something. So no plagiarism. That's just one example. I recently had a session where there was, the session was 31 techniques for formative assessment. And they were spending like 2 minutes each on each technique. And that 31 was like top 31. If you go online, you can find 100 techniques of formative assessment. There are 2-minute paper, there is exit ticket, there is 3-to-1, and there is gamification of assessments and knowledge. But the point is that we should consider interactive learning much more than a seminar-based learning, where student is learning by doing something, not by just listening to a video. And that assessment should fall into learning and teaching part, and only summative assessment. A very small portion should be left in the bucket of assessment itself. Let me invite Professor Balkis to add her thoughts on this idea of impact of COVID on medical education and where are we heading in next 20 years in medical education. Professor Balkis, please go ahead.
Assalamu alaikum. Thank you so much for including me into the discussion. I joined a little late, but what I saw was Aliezeh Fatima. Probably she's a medical student. Am I right?
Yep.
She was giving her views about the latest trends, and I listened to Maha, I listened to Aqsa. And these were wonderful points I came across. And actually, we have left the word teacher. The new word is facilitator. Absolutely. And it's no longer student, it's a learner. So there has been a paradigm shift in the process of learning, and this holds true for the medical education as well. As far as COVID-19 is concerned, every challenge brings opportunities. And I think though we had very negative events and we have very, a number of deaths and all that, but we learned something positive out of this circumstance as well. And that one was modification in the mode of medical education. I am chairperson of Department of Medicine at King Edward Medical University, and also professor of medicine there. And we learned, as probably Maha was saying, or Aliezeh was saying, that our teachers need to learn. Definitely we had to learn on the Google Classroom. We had to learn how to, record our lectures. I remember the first lecture I recorded, they could only see my picture and not the video. So then I learned few more programs, and yes, we learned with that. So yes, we did learn. And one thing which, I think which should be focused, because I think I am probably a little junior to Professor Waqar Azeem, and perhaps contemporary of Dr. Amir Burney. Like, I'm in between the very, very senior and the very, very junior teachers. So I can feel the pain of the students when they say the teachers are not interactive, and they are not exhibiting on the patient. Like Dr. Amir said that he's thankful to his son for when he requested him to expose himself for examination of the joint. So that is being intel, that's showing to the students what actually you want them to perform and how you want them to perform. So I definitely believe on problem-based learning, on scenarios, the concept of lectures. Now that is something which is really being under controversy in Pakistan, because here we have big universities like King Edward Medical University and Fatima Medical University, where we have students more than 350. Now, how can I interact with a class of 360 students without, being, totally non-interactive with them? It's very difficult. I'll interact with the extreme 10% who are sitting on the front rows, or the extreme 10%, the other 10% who are sitting in the back rows. The in-between 90% are lost somewhere. So the concept of lectures, now this, what we did in COVID was, we put on Google Classroom all our lectures. And this webinar today is going to be, inshallah, very productive for us, for me, because from 15th of September, you might be knowing, we are opening our medical universities. And what we are doing is, we are not going to hold lectures now, because all of them have almost been completed on the Google Classroom. We are going to make interactive sessions with the students on the patients. Now, on the patients means either they are simulators, or we are going to put on problem. And I learned from Aliezeh and Maha that why not that you put on problems and discuss the probable differential diagnosis and how to approach. But one thing which I strongly believe in, and probably Professor Waqar and Dr. Amir and Dr. Danish would agree, because we do have that, that old school of thought hidden somewhere, because we grew out of that, that you have to interact with the patient, because you would not be able to appreciate collapsing pulse until or unless you actually palpate for it, You would never be able to hear, I mean, I'm talking about Pakistan, where you might have to work in areas where you first, basic investigations like echocardiography may not be available for a month. So you have to listen to the precordium. You have to be able to pick up the systolic murmurs. You have to be able to hear the heart sounds, the breath sounds. So we are still, being in Pakistan, we have to use our equipment and on the patient. So there is nothing, no better teacher than a patient, believe you me. But at the same time, in COVID scenario, we'll have to be very careful. We are actually, this discussion has been very productive, and I'm very grateful, especially to Aliezeh, Maha, and Aqsa, who have given me, some new suggestions how to go about it. We can put on a problem-based scenario, select one of the few patients who is COVID negative, and then subject him or her to examination by the group of students who are with us. So, I mean, we have to be very careful regarding COVID and the exposure, maintaining social distancing. And believe you me, this summative assessment जो हमारी हुआ करती थी, सर वकार को पता होगा, आमिर साहब को पता, the very last day of Viva, and I mean, at that age, the palpitations and the sweating and all that, and even at this age, when we have to appear for an interview, it's sort of a summative assessment of your whole life. What have you been doing the whole life? And we still everywhere, all across the world, when you go for an interview, that is, they assess you like anything, and you are, at this age, I don't know what might happen with the coronaries at that moment, which did not happen when we were 22, 24 years of age. But I think the concept of formative assessment is very important, and it is now being introduced in our new system of medical education. Here, I would also like to share that in King Edward Medical University, probably most of you know, whoever has joined the King Edward Medical University Facebook page, official Facebook page. If you have not, you can join. we have completed, we have rather started the second session of Certificate in Medical Teaching. That is training of our teachers into these new methods, which Aliezeh, Maha, and Aqsa talked about. How to modify, you know, you remember Professor Waqar, there used to be transparencies which were read by the demonstrators, and we used to be, you know, scrolling on the papers and playing zero kanta. So now, probably they are playing zero count on their phones nowadays, but I allow them to. I say, okay, as long as you don't create noise, you know, do that if you want to. But what I believe in is the interaction and, you know, making the, if you are delivering a lecture to such a big class, making the PowerPoint slides as minimum and as concise and as picturesque. As somebody said, pictures attract you. And they remain in your mind for some time. So I strongly believe in that. And I'm one of those pathetic students. I'm still now one of those lousy listeners who sleep after 10 minutes. To be, I'm exaggerating, I mean 5 to 10 minutes. So I can, you know, correlate with all three of them that yes, we have to make it interactive in some way. And so this, we have started Certificate in Medical Teaching, and we are getting good feedback from our teachers that they are realizing their mistakes. And this only a day before yesterday, we finished with the first session of the second batch. So I proudly say that because I'm a part of that committee, and we are arranging under the supervision of the Vice Chancellor. You must be knowing that he's also PhD in medical education.
Yes,
so he is inculcating all these newer concepts into our, you know, learning and learning of the teachers as well. As probably Maha said this, that the teachers need to learn as well. And I very truly agree with that. And COVID, in fact, has given us a chance to learn. I'll end here with one quote, which you know, ever since I've become a teacher, it has stuck in my mind. And I hope I reach the 4th level if Allah allows me. I'm nowhere near it, but I'll read that quote out to you. The mediocre teacher tells, a good teacher explains, the superior teacher demonstrates, and the great teacher inspires. So Professor Waqar and Dr. Amir and Dr. Danish must immediately, I know there somewhere in the mind you must have picturized one or two of your teachers who inspired you. At least I can, you know. So I hope your teachers are those who inspire you. Your teachers are those who are learning at the same time. And I hope I'm one of them. Thank you so much, Dr. Danish,
Thank you,
for
Professor
including me in the
Bilkis. Thank you
discussion.
for joining us and being here. I'm gonna,
Danish,
so
can I say
Professor
something
Waqar,
quick?
let me, yeah. So I know Dr. Amir has some comments to make, and he has been in the queue. And Professor Waqar
Okay.
has a comment to make,
Sure.
and I'll add you to the queue. And then why don't I come to you for closing, Professor Waqar? And I see a hand raised by Muhammad Mataro. And I will also take you on for your comment right after Dr. Amir Burney. So please be ready. Dr. Amir, please go ahead.
Oh, thank you, Danish. Professor Bilkis, a pleasure to meet you online and to listen to your wonderful thoughts here. And I couldn't disagree or agree more. I think what you just said hit the nail on the head. The number of times I've heard from medical students, even when I was young, show me the exam and I'll do the learning. Or the assessment is the tail which wags the dog. And I think we need to flip it. Many times when students have asked me, especially final year students, saying, is this good enough for the exam? And I say, will this be good enough for when you are sat alone at 2 o'clock at night doing your own call? If you can do that, then you'll be absolutely fine for the exams. The exams are just a stepping stone into the real world. And the real world is so much more different to what we actually spend 5 years or 6 years of medical schools. And just going back to what Aqsa said earlier, I totally agree with you. I think having a built-in intercalated degree into a medical school, or the option of doing an intercalated degree, I think should be there. Whether you do it as a 5-year course built-in or a 6-year plus one on a 5-year course is absolutely, I think, essential. It really develops people and shows that people want to do other things as well in their medical career. And I totally agree with the word facilitator. I think I see myself more of a trainer facilitator now, rather than as a tutor or a teacher. I think it's imperative that there's interactivity, as you said, of any level, of any degree, doesn't matter. And you mentioned the lectures. I still believe the lectures are a great way, a very economic way of delivering education. You can actually, one person delivering to 300 people plus can do. But how do we make these lectures more interactive, attractive for students so they are actually attending? We have talked about the ideas of flipped classrooms where not much content is delivered but is actually asked. So the students have some pre-reading to do before they come to the lecture. So maybe the flipped classroom is an idea to work with. It's working in some parts of the world as well. So I've experimented with it. Or breakout rooms from the lectures. You actually break the lecture into smaller groups halfway through. So there are ways of making the lectures slightly more interesting. But I totally think, I think the best teachers I've had have been my patients at many times. So I've got so many inspiring people in my life in and outside of medicine who have really taught me how to be not just a good person, but also be a better doctor. Patient is our center of work, service, and education. So we cannot take the real life patient out of this mix. And I think we have to, whatever training we do in preclinical years or integrated course or PBL course, it is all directed towards how to manage our patients better. So the patients are our center of care, no matter where we are, whether it's AI or not, whether we work in a village in Pakistan or even in remote areas in the UK, we do not have access to fantastic equipment. So you have to really rely on your clinical acumen and your ability to diagnose a condition. I saw a question, if I just may finish off down this, by Professor Khalda Zaki, and she really brought up a very good point about cultural competency and cultural intelligence, and how do we incorporate this into the current medical undergraduate curriculums. I think we are due for an upgrade across the world for medical education curriculums, public health, disaster management, pandemics, cultural intelligence, cultural competencies. They have to come in. We need a multidisciplinary medical undergraduate curriculum to help our students for the future. Thank you.
Thank you, Dr. Amir. Mohammed Mataro, please go ahead, introduce yourself and make your comments.
Assalamu alaikum from Saudi Arabia. Am I audible to everybody?
Yes, you are. Please go ahead.
I am Dr. Maha, the family physician.
Hello. Hello. Hello, sir.
Hello,
So
is it Mohammed Mataro?
I thought I lost the contact. Hello.
Yeah, Dr. Mataro, please go ahead.
Yeah. Sorry for interruption, sir. I'm a family medicine specialist here in Saudi Arabia, and I am also involved in the training of medical students, interns, and the family medicine residents here. So I completely agree with the comments of Aqsa that COVID-19 has looted many things from the doctors, especially our close contact with the doctor. We used to touch the patient, and that touch of a doctor had a healing effect also. Like Parveen Chakar said that उसने जलती हुई पेशानी पे हाथ जो रखा, रोह तक आ गई तासीर मसीहाई की. तो ये जो तासीर मसीहाई की है वो कोविड-19 की मेहरबानी की वजह से जो है वो थोड़ी सी डम पड़ रही है इस कंडीशन में. So यकीनन there are many things that are happening. The technology is advanced a lot. So many things like murmurs and other things, physical examinations. We have now the digital gadgets that tell us everything. We have a digital stethoscope. We have the digital ultrasound, handheld ultrasound, which could be connected to our cell phone or iPad, etc. So these things, actually, the physical touch could be replaced with the technology. But what the Dr. Waqar said, that empathy, our compassion, our connection with the patient, that could not be replaced with the new advance of the technology. But as Dr. Maha said, and another her friend said, medical student perhaps, that the world is changing and we have to adjust with the new advanced the system, the educational or academic system, which is we are going to face in the future. So we have to advance with the changing world. So I will request Dr. Waqar that you are a psychiatrist, so you should work that how can we digitalize this empathy and compassion, and how can we connect electronically by heart with our patients and by soul. Thank you so much, sir. Thanks
Thank you,
for
Dr.
such a
Mataro.
thought-provoking.
Let me
Yeah.
go ahead to Professor Waqar for your closing comments and wrapping everything up. Professor Waqar.
Sure. First of all, to Dr. Mataro. Dr. Mataro, you are in Saudi Arabia. Kindly, you have to go to Makkah to pray to digitalize empathy. That is the only way I think. First of all, Professor Bilkis, I think I learned so much from you, all your comments, and very helpful. And of course, I hear from Dr. Nazish, who I'm working with for about 15 years now in King Edward, that what an amazing work you and your team is doing and Dr. Nazish is doing. So thank you so much for all what you do for the children, women, adults, families in Pakistan and Lahore. Thank you so much. I learned so much from you,
Thank
Aliezeh,
you so much.
Maha,
Thank you.
sure, and Dr. Aqsa. You all have made my day. I think the more I'm getting experience, the more I think I don't know. So everything day is a learning experience. And I can't imagine every day I make at least 2-3 mistakes in my profession every day, every single day. So I've learned how to learn from my mistakes because that makes you better. AI, of course, is very important. I'm a child psychiatrist, so of course, interpersonal relatedness is very important. I give you one example. I was in Medina, and I do a lot of international consultations, and there were children who I have to see. And this lady in hijab, traditional hijab covering her face, came with a child with autism who I have to see. And she and the physician wants to present about the child with autism. And the lady is expecting I will examine the child about autism, will go through the diagnosis. And my second question was from the mother, how are you doing? And that lady has tears in her eyes. Nobody has ever asked that question from that mother, that what is the impact of this child on the life of this mother who take care of this child around the clock. And I still remember that I don't think there'll be any replacement for physical or emotional touch. Secondly, if some of you, I don't know the system for postgraduate training, but probably you still do that, at least well-known programs in US. I was a training director and I interviewed a lot of people, although it was for child psychiatry, but still I think a lot of training directors do that. I know how to train people clinically. I want to see what kind of a human being is this, not what kind of a physician is this, that how good that clinic, because if you've done the medical school, if you've done good scores, if you achieve the interview, I'm done with your clinical side. My job was to see what kind of a human being you are, what kind of humanistic characteristics you have, whether you will relate better interpersonally with families, children, adults, peers or not. So there was mainly, I look at when I was picking up my residents, fellows, not their scores or clinical judgment or those kind of things. Just lastly, for the medical students, I think I was in your shoes, I will tell you, 30 years ago in Rawalpindi. And what I have learned in life, the most important thing to be successful is not just the teaching or what you learn, it's in your head that you need to have a belief that anything is possible and you can achieve anything. And I think that will take you a long way. And thank you so much. It's great to have you all and wonderful to see such a wonderful, enthusiastic audience, panelists, and speakers. Thank you, Danish.
Thank you, Professor Waqar. Thank you, everyone. And in the end, I again want to thank our lead for this webinar, IFMSA-Pakistan, International Federation of Medical Students Association, a truly dynamic group of people. And I'm so looking forward to working with you guys. And I also want to personally thank Dr. Amir Burney, here representing APPNA, Association of Pakistani Physicians of Northern Europe, president of APPNA, and an extremely dynamic people working with so many collaborations with APPNA Merit, and we're looking forward to, and we're thankful for all your work for Pakistan, Dr. Amir. Thank you, everyone. You have a nice day. Assalamu alaikum.
Alaikum.
Wa alaikum assalam ji. Allah Hafiz ji.